Hello, my name is Cassie Hernandez, and my disease I will be informing you on today is cerebral palsy. Alright, so what is cerebral palsy? It is defined as the difficulty in coordinating muscle movements or maintaining a normal posture that is caused by brain dysfunction. It does not include problems in the muscles, peripheral nerves, or the spinal cord. So this is not a muscle disorder, but a brain disorder. The disease is also a static disease, which means that over time it will not get worse. So when does this occur? Cerebral palsy occurs in early childhood. It happens in one of three periods: the prenatal, which is before labor, the perinatal, which is from the time of labor to the first few weeks of a child's life, postnatal, which is after the perinatal period. And why does this occur? For prenatal events, it has to do with genetic disorders, exposure to toxins, or abnormal blood flow to the brain. For perinatal events, such as asphyxia or the lack of oxygen, or even brain hemorrhage. And for postnatal events, it relates to things such as TBI, which is traumatic brain injury, brain infections, and rarely does it involve cardiac arrest. The severity of cerebral palsy depends on time of development in which the brain damage occurs. Before 32 weeks in the womb, the brain is more vulnerable. For over 30% of all cerebral palsy cases, the reasons are unknown for the cause of cerebral palsy. As for the types of cerebral palsy, there is one of two, which starts with physiological. This is the nature of movement disorder. Within that, there is spastic, which is defined as the increased muscle tone that causes stiffness, so movement is hard to control. The second within that is non-spastic, which is the damage of nerve cells in the top of the brain. Typographical is the second, and it is more the pattern of limb involvement, and it includes 5 different types. The first is monoplegia, which affects one limb of the body. The second is diplegia, and this affects both of the legs. The third is triplegia, and it affects one arm and both legs. The fourth is hemiplegia, and this affects one side of the child's body. Quadriplegia is the last one, and this affects just the entire body. As for speech and communication, speech disorders exist in over half of the people diagnosed with cerebral palsy. Dysarthria is defined as difficult or unclear articulation of speech that is linguistically normal. So, in other words, it is when you have difficulty saying words because of the problems with the muscles that help you talk. And this occurs among 31 to 88% of those with cerebral palsy. Speech problems are associated with poor respiratory control, laryngeal and velopharyngeal dysfunction, and oral articulation disorders that are due to restricted movement in the oral facial muscles. The diagnosis of cerebral palsy should be made within or between the first 3 years of a child's life. The physician will examine the child and compare their performance of motor tasks appropriate to their age group. A diagnosis also requires a complete history physical examination, and additional investigations to look at other possible causes. Treatment includes observation, physiotherapy, device-assisted modalities, oral intervention, medication, and even surgery. Parents that have children with cerebral palsy should look into working with physical therapists, occupational therapists, and speech and language pathologists to find the most progress for their children dealing with cerebral palsy. Some who have been diagnosed with cerebral palsy might think that they have lost hope. For parents looking for additional information regarding cerebral palsy, I recommend the book titled Children with Cerebral Palsy by Elaine Girarlis. It is a parent's guide to help answer questions as well as inform parents on how to deal with the disease by knowing what to expect. On page 182 of the book, it shows parents an outline of what skills are usually achieved by most children during the first 3 years of the ages that are achieved. The chart ranges from a month-to-month basis, and it also charts gross motor, fine motor, language, cognitive, self-care, and social development. This can help the parent chart how their child is progressing and if they feel their child is experiencing abnormal signs. Some examples of normal development would be an example of 8 to 12 months could be gross motor, which would be standing alone and walks with help. Fine motor, which stacks 2 cubes, releases, hold on to objects, uses pincer grasp, and can hold a crayon. For language, the child should be able to respond to no, wave bye-bye, echoes words, may use 1 or 2 words, uses gestures to get things. Cognitive, the child should begin to look for hidden objects and nest 3 boxes. For self-help, the child should be able to take off socks and attempt to use a spoon, and as for social, the child should be able to be wary of strangers and may be more negative. Then the book goes on to illustrate reflex milestones presented in a chart for children with cerebral palsy. An example here would be the neck riding reflex, and if the infant is on his back and the head is turned to one side, the shoulders and trunk turn to the same side. This reflex is used when rolling from back to front, and if the muscles are weak in the trunk, shoulders, and neck, your therapist can demonstrate baby exercises which strengthen muscle tone and promote coordination. At the very beginning of the book, in chapter 2, I found it helpful for parents to understand that the emotions they are encountering are normal. The chapter focuses on emotions ranging from getting the news, shock, denial, grief, guilt, anger, and resentment. The book gives a few good quotes of parents reactions to having to deal with a child experiencing cerebral palsy. A few good examples I thought were relatable for most parents were, first, I don't wait around for him to reach milestones. He was never supposed to talk. There have been enough pleasant surprises that I feel there will continue to be more. That's what we have to continue to remember. Another good one I thought was, It's really hard for me to watch my sister's baby crawling around and just naturally picking up all these skills Timmy has to slave over in therapy. I mean, I can't blame my sister for bragging, but I wish it weren't all so unfair. The last one I thought was pretty good was, initially in the back of my mind, I kept saying Ellen would show the doctors they were wrong. She would be okay. It's like finding the magic cure. I guess a lot of parents go through similar feelings, and not having an idea of what to expect didn't help at all. Always hearing "we don't know" was frustrating to say the least. It is important for parents to know that it is important to address these emotions, that they are not alone, and to accept their child while moving forward in a positive way. An example of a family that moved forward in a positive way is the Hoyt family. And on January 10th, 1962, Rick Hoyt was born with cerebral palsy. His father, 66-year-old Dick Hoyt, loves to participate in marathons and triathlons, but he doesn't attend these races alone. He includes his son by pulling Rick in a special boat as they swim. He carries him in a special seat in the front of his bicycle and pushes him in a special wheelchair as they run. Dick states, "Rick is a motivator. He inspires me. To me, he is the one out there competing, and I'm just loaning him my arms and legs so that he can compete." I thought of this to be an inspirational story to recommend to parents with children suffering from cerebral palsy. Just because that their child is disabled doesn't mean it is the end of the world for them. If I was a child life specialist dealing with a cerebral palsy case, I would let the parents know about the possibilities their child can achieve through therapy and intervention. I would also highly recommend the book on cerebral palsy so that parents feel more familiar to the disease and can chart how their child is progressing. I would encourage parents to not lose hope and to believe that things will grow easier with practice and patience. Thanks for listening to my presentation on cerebral palsy.